Hello friends, today we will start tiredness and I will start with data gathering. Like we have a few scenarios of tiredness in which the presenting complaint is tiredness. The patient presents with complaint that he's a bit tired these days, and this is a kind of chronic complaint that patient comes with. Like there is some 2 months or 3 months history. So one tip that you have to remember is whenever you have a complaint in which the patient has some chronic illness or chronic problem, then you have to ask about psychosocial and mood. All right. So, regarding psychosocial, what you will ask about the effect on living, effect on their daily activities, effect on their job. All right. Okay. So, let's start whenever the patient presents with tiredness, whatever we will do, like we will explore the presenting complaint. All right. So, for any complaint other than pain, we ask Odipara. Like we will ask, since when you are having this problem? All right. And is it progressing or has been the same since started? All right. Then you will ask anything that makes it better, anything that makes it worse, Odipara. All right. So, the main focus today is some differential diagnosis, and we will discuss the questions as well. All right. So, we have a mnemonic A, B, C, D, F. Everybody knows it. All right. So, regarding A, we have two differential diagnoses. One is anemia, and the other one is apnea. So, anemia, we have a few questions to rule out anemia, like we will ask any heart racing, any shortness of breath, or by any chance any lightheadedness, any dizziness that you notice these days. And if you feel that yes, it is anemia, then you have to rule out the cause of anemia. All right, so you will ask any bleeding from anywhere, any recent surgery, any changes in stools, like stools could be um black colored stools due to the bleeding from lower GI system, you know it, and difficulty in flushing stools like for malabsorption. All right, so you will ask a few questions to rule out the cause of anemia when you have diagnosed that it is anemia by asking a few questions that I discussed, which are heart racing, SOB, lightheadedness. All right, and mostly these are follow up cases. Like the patient had tests and it showed like HB is low, and then the RN tests have been done and ferritin is low. So you will get a diagnosis of by follow-up cases, and then you will ask about the complications. All right. So for the complications, you will ask any dizziness, any fatigue. Okay, like these are the complications of anemia. So anemia could also be vitamin B12 deficiency anemia. So in this case, they will give you like vitamin B12 is low. Okay, so all right. So vitamin B12, I will discuss it for you, which is missing here. Vitamin B12 is mostly presented with some neurological symptoms. Like the patient will say, we have some tingling and numbness in the feet, and they will say that we have some balance problems. All right. So they can also give you some test results which show that vitamin B12 or folic acid is low, or they will give you a test of MCV, like volume of red blood cells are larger. 80 to 100 is almost normal. So in iron deficiency, they will give you some 75 or 65, and vitamin B12 they will give you 120, 100 above anything MCV will be vitamin B12 mostly. All right, so regarding vitamin B12, you will rule out like it could be alcoholism, chronic alcoholism, that will cause higher MCV. All right. So we have covered our A part. All right. So regarding apnea, which is any sleeping problem, and it will come with tiredness, like the patient is not having good quality of sleep, so he will come with some tiredness. So what you will ask, like, how is your sleep? Do you feel refreshed after waking up? And then you will ask, like, has anybody told you that you snore a lot during your sleep? He will say, yes, my wife said it to me. And mostly these patients are obese patients. And you can ask about daytime dosing. They usually doze off while they are driving. You should also ask about driving. This is really important in this. All right. So, regarding B, there is TB. So, mostly TB will present with cough, fever, weight loss, and then homeless or IV drug abuser they could be. So, you will ask about all the possibilities. You will ask anything else along with tiredness, and they will say, yes, I feel a bit feverish, feel a bit hot, they mostly say. So, you can diagnose by certain things like being homeless, or asking about their socioeconomic status, like whom do you live with, anyone else, and they will say, like, I don't have home, I don't have family. So it could be TB, but mostly it don't present with tiredness. All right. We have a few stations that come again and again with tiredness. So up till now, TB is not there, but for differential diagnosis, you can ask about fever. So similarly, as you know that we have to rule out all the red flags whenever we are asking about anything, if, whenever you forget about differential diagnosis, remember flaws. All right, these are the red flags. This is really important. They will add to your marks. All right. So flaws is fever, lumps and bumps. You couldn't ask like lumps and bumps directly to the patient because it will feel a bit odd. So you can say any swelling anywhere in your body. Like they will say, yes, I have felt like hair in my neck. So you can judge, like it could be lymph node swelling, and when it's lymph node swelling, it could be TB, it could be cancer. So you have to do lymph node biopsy. All right. And also chronic fatigue syndrome is really common in tiredness. All right. So going to um, diabetes mellitus. So I will discuss chronic fatigue syndrome. When you have excluded all the differential diagnosis and you're unable to make any diagnosis, and mostly to make it easy, they will give you a history of viral infection. Like when you will ask, did anything significant happen before this tiredness? And they will say, yes, I had a fever and flu like illness. All right. So, one thing is you can add fever and flu like illness in your differential diagnosis. Like you by yourself can ask along with fever any flu like illness. So they will tell you, yeah, I had a flu like 2 months back. But in chronic fatigue syndrome, the tiredness is about 6 months of duration. If it's more than 6 months duration, then it's chronic fatigue syndrome. It's a chronic thing. All right. So diabetes mellitus could also present with tiredness. So you can ask going to the loo more frequently, you're more thirsty. Then if they say yes, yes, then you can ask about the complications of diabetes, which are any problem with your foot, any problem with your VN. All right. So regarding drugs, certain drugs like citalopram and steroids. So this will present with low sodium, like hyponatremia. So we have a few cases in which stelopram, as you know, is used for depression. So the patients give you history of depression, and then you will judge like Yes, they are using stelopram. And then you will ask, has this tiredness started before or after using the medication? That is the key question that you have to ask. And they say, yeah, this is after starting stelopram. Then you know that this is the culprit that is causing tiredness. And then steroids. Like mostly the patient is having some respiratory problem. Um, the PET scenario that we have regarding steroids is the patient is presented with COPD and now he has hyponatremia. So it could be SIADH as well. So what you need to do is you will say some camera tests, some scanning like CT scan of the chest, bronchoscopy, your ADH levels. That will give a hint to the examiner that you're thinking about SIADH, and you can also tell, like, in worst case scenario, these symptoms, these low sodium symptoms, could also be due to cancer, but we need to rule out and we will refer you urgently so that you are diagnosed earlier and then you're treated. All right, so endocrine. Endocrine is hypothyroidism mostly. All right, so you have a few things. I will cover hypothyroidism in a separate video. There I will discuss the whole symptoms of hypothyroidism and hyperthyroidism and few things that you need to remember. We have a mnemonic for thyroid like BMW, where we ask about bowel changes, some mood changes, some weight changes, some weather preferences. So here hypothyroidism, the weather preference is they feel a bit more cold than other people and they have a weight gain. All right. So in fibromyalgia, sorry, it's wrong. It is joint pain. All right, you will ask about joint pain. Okay,